new set of regulations tucked into the Trump administration's big, beautiful bill removes nursing from a list of professional degrees. The change, which would take effect in July, caps their student loan borrowing options. Critics warn that move could shrink an already strained nursing workforce. You'd know that if you visited a hospital anytime in the past few years. And it could potentially leave patients at risk. And as you might imagine, nurses are not happy.
Nursing is one of them careers that pull you up out of poverty. Gives us a great opportunity to provide for our families and for our life. Most homeowners I know, nurses. A lot of heads of households, nurses. A lot of minority women, nurses. So declassifying us as a professional practice, you thereby limit our access to funding. So you limit a lot of women and minorities women access to further climb the socioeconomic ladder.
As a nurse who worked during COVID, you're heroes. Thank you for all the hard work you did for taking care of our grandparents and keeping them alive and putting yourself at risk and not being able to see your family. And now we're not professionals. Now we don't matter.
Joining us, the president of the American Nurses Association, Jennifer Mensick Kennedy. Thank you so much for joining us. Explain to me exactly what it means to take away the categorization of a professional degree.
No, absolutely, and thank you for having us. This is really important because it's not semantics. So when we reclassify nursing, now, to be clear, we were never completely explicitly included in the definition, but we were included in that loan limit. And so as that committee came back, they decided to explicitly exclude nursing, even though we meet that definition from an advanced practice perspective. And so the downhill side effects of this could be even larger, as this definition could be adopted in other areas and other departments. This is going to stop nurses, those who are going for advanced practice degrees, nurse practitioners, nurse faculty, certified registered nurse anesthesiologist, from being able to borrow what they need to borrow to go to school. That's devastating.
Yeah, let's talk about the costs. What is nursing school costs? And up before now, what could get paid back?
No, absolutely. So those going to school in advanced practice registered nurse, whether it's East Coast, West Coast, there are many programs that exceed $100,000 just for those degrees. And it's important to note that when we cap it, so removing the professional status caps nurses to no more than $100,000 in those loans and no more than $20,500 per year. So you're going to see people trying to get private loans because this is not going to stop nursing school from being more expensive. People are going to try to go get private loans, and those private loans are excluded from federal payback systems such as the Public Service Loan Forgiveness and some of these loan repayment programs for rural areas, of which primary care providers such as nurse practitioners are the largest provider in those areas. So this is going to have devastating effects for rural communities. And I'm going to say this is more like a triple threat to the nursing profession. In the Big Beautiful Bill, not only did they move into this RISE committee, but they removed Title VIII funding. So the only federal funding nursing education got, which is a little over $300 million, was totally stripped from the budget. And with the cuts to Medicaid and subsidies, as healthcare providers and hospitals are trying to figure out how to cut costs, they're cutting tuition reimbursement to nurses. So across the board, there's just less funding for nurses to even try to go to school.
I have to tell you, in talking to people that I know that are in the healthcare industry, it includes nurses, it includes doctors, in private practice, in public practice, at hospitals. Everybody seems pretty miserable right now. Post-COVID, they all feel burnt out. There's a shortage of staff everywhere. Dealing with the insurance companies has been miserable. They complain that it's not the profession that it used to be, that you don't make the money there that you used to make, and you don't have the respect that you used to have in the industry.
No, it's absolutely true. One of the most alarming statistics is that nurses are more likely to be assaulted at work than a prison guard or correctional officer. The work environment is very vastly different, but we still have people who want truly to go into nursing. We had over 80,000 qualified applicants turned away from nursing programs last year, mostly due to a lack of nurse faculty.
Yeah, this is a big deal. It's a big deal for anybody who's worried about the quality of care wherever they live, especially, as you said, though, in rural communities that don't maybe have access to hospital systems, to doctors, and a lot of the time the nurse practitioner is the highest ranking caregiver. Thank you so much, Jennifer Mensick Kennedy. I appreciate you coming on, and we're going to keep an eye on this. If something changes, please do come back.
Absolutely. Thank you.